Hi, good afternoon. My name is Aiza Macalalad, one of the nursing supervisor at Tabeeb Medical Services. So today we're going to discuss about wound care. But first, let us discuss what is wound. Wound is a break in the skin which may result from physical, mechanical, or thermal damage or develop as a result of an underlying medical or physiological disorder. What would be the possible causes? First is by being immobile. Imagine your patient laying in bed for a long period of time, or your patient is bedridden for almost a year. Of course, there is a higher risk and chance to develop bed sore and pressure injuries. Significant trauma injury to the skin. It might be caused by friction when you move your patient or when you transfer and position your patient. Surgery or incisions cut made during operation which might become infected and slow to heal. Deep burns, underlying medical conditions such as diabetes or some types of vascular disease. For the diabetes, sometimes it might lead to diabetic ulcer. Specific types of infections such as Burnsdale or Buruli ulcers. This one is common caused by Mycobacterium ulcerans. And this one is a infectious disease characterized by painless open wound, and the appearance it looks like a spider or mosquito bite. For the trophic ulcers, where a lack of sensation allows everyday trauma to lead to an ulcer, such as in diabetic neuropathy and leprosy. Common types of wound. There is burn, surgical, pressure injury, fungating, diabetic ulcer, skin tear, abrasion, or cut. Stages of wound. We have stage 1 up to stage 4. As you can see here on the picture on the right side, on the stage 1, there is a redness and discoloration around the area. While the stage 2, there is a blister or there is a redness area with superficial skin breakdown. And for the stage 3, there is a deep tissue involvement. And for the stage 4, there's an invasion of deeper tissue, muscles, and bones. There is a full thickness loss of the skin. We also have the Wagner classification of diabetic ulcer. As you can see, we have grade 0 up to grade 5. For the grade 0, see the picture, there is no any open ulceration. For the grade 1, there is a full thickness ulceration, but depth doesn't go beyond. Well, for the grade 2, there is a deep ulcer. You see this ulcer, but there is no bone involvement or abscess formation. But there is a deeper tendon or joint capsule may be exposed. While for the grade 3, as you can see here, this one is open to bone or osteomyelitis, and this osteomyelitis may be present. Having this kind, there might be swelling, redness, and pain around the area. And for the grade 4, it could be wet or dry gangrene. There is a localized gangrene here. And for the grade 5, there is an extensive gangrene indicating higher risk for amputation. For the degree of burns, we have first up to 3rd degree. It's, as you can see in the picture, the first degree burn here, injury to the top layer of the skin only. While for the 2nd degree, the injury is up to the 2nd layer of the skin. While for the 3rd degree, it is down up to the 3rd layer or up to the subcutaneous tissue. The affected area is up to subcutaneous tissue. Okay, next is cellulitis. We all know that cellulitis is one of the most common skin condition, and it can be serious or fatal if left untreated, because the infection can also spread to your blood, bones, lymph system, heart, and nervous system. And these infections can lead to amputation, shock, or even death. So let us proceed to the stages of wound healing. First is the hemostasis or bleeding, the inflammatory phase, the proliferation, and for the remodeling. For the hemostasis, it will occur within seconds or minutes after you suffer a wound. Then during this phase, your body will activate the emergency repair system to form a dam to prevent any blood loss. For the inflammatory phase, the most commonly seen during this stage of wound healing, there is a redness, heat, pain, and swelling. For the proliferation phase, when the wound is rebuilt with new tissue made up of new collagen and extracellular matrix. While for the remodeling or the last phase, there is a granulation, tissue formation, and the formation of new epithelium and scar tissue. So what are the factors affecting healing process? First, we have to consider the age of your patient. We all know that everything slows down during aging process. And once we get older, our skin gets thinner and the body shows decreased inflammatory response. For the type of wound, we also have to consider this and always remember the larger the wound, the longer to heal. Again, the larger the wound, the longer to heal. And also the shape of wound plays an important part in healing process. Why? Because the type of wound, the linear wound, heal faster than the rectangular wound, while the circular wound are the slowest to heal. Again, for the shape of wound, linear wound heal faster than rectangular wound, while circular wound are the slowest to heal. Next is infection. Of course, if the wound is infected, it might cause the delay in healing process. So how will you know if the wound is infected? There is a redness around the area, or there is a swelling, there is a pus or discharge, and a foul smell, and sometimes your patient develops fever. And if the wound is infected, it requires treatment and good wound care and also administration of antibiotics. Next is chronic diseases. Those patients who has DM or have diseases affecting their circulatory system may be inhibited wound healing. Also, those patients who has poor nutrition and lack of hydration, this can also help cellular migration, decrease blood oxygenation, and seriously delay the healing process. Those patients who had edema, of course, it might increase the pressure on the blood vessels resulting to poor blood circulation. Repeated trauma, if there is a continuous re-injured, of course, there will be delay in the healing process and for the patient's behavior. This is important because some of our patients are non-compliant to treatment and even for the medication. Those patients who has bad habit, poor sedentary lifestyle, those patients who has lack of sleep. What else? Those who are not receiving a good wound care, those who has an inadequate wound dressing, these factors might cause the healing process. Next is for the wound care assessment. This one, you can find this on your patient's file, on the patient's record. In this assessment, you will, on this side, you will put the patient sticker. Then for the initial assessment, date when you started doing the assessment and the time. Then you have to answer where or how wound was acquired. Is it in hospital, at home, traumatic injury, or is it a surgical type of wound? Your Braden scale. So we'll see later where will you get the Braden score. For the type of wound, you have to know if it's burn, surgical, pressure injury, fumigating, diabetic ulcer, skin tear, abrasion, cut, or other. For the wound assessment, for the location, it will be depend on the location of the wound. Like for example, if your patient has wound on the buttocks, so the part of the buttocks, the part of the wound here is from letter F and 12. That's why for your location, you have to indicate F and the number 12. Okay, for your wound assessment, there is a condition of the wound. You have to know if it's a clean wound or infected wound. I already mentioned earlier what are the signs of infected wound. And what are the factors which may delay wound healing? It might be because of wound infection, there is a necrotic tissue, bowel incontinence, bladder incontinence, there is a immobility, malabsorption. How about the diabetes? Patient is having anemia, drugs, arthritis, nutrition, elderly, and others. And also, what are the instructions to help wound healing? Okay, it might be because keeping skin clean and dry, adequate nutrition, wrinkle-free bedding, use of air mattress, it might help. And changing positioning every 2 hours, observe sunset infection, heat protector, and others. This one, I discussed this earlier. And for the tissue type, these are your legends. For N for necrotic, S for sloughy, G for granulating, E for epithelialization. For the drainage, you have to write O if there is no drainage, SR for serous, SS for serous sanguinus, and BL for blood, and PR for purulent. For the peri-wound skin, H for healthy, I for infected, F for macerated, O for other. If there is any odor, so you have to put MLD if it's mild odor, if it's foul smell, write FL, and O if none. On this Braden scale skin risk assessment, all you have to do is to put your score which applied to your patient. Then after that, you have to tally and put the score here. So if the score is 15 to 16, it means your patient has low risk to acquire a bed sore or pressure injury. 13 to 14, if there is a moderate risk. 12, less than 12, your patient is high risk. We also have diabetic ulcer. I also explained this earlier. For the star skin tear. We also have the category 1 up to category 3. Surgical wound classification. I also discussed this. And the degree of burns. Of course, if there is a wound, there is also a pain. Okay, so all you have to do is to do pain assessment by asking for the pain scale from 0 to 10. 0 being no pain and 10 for intense pain. Is there any pain present when touching, anytime, or only when you're performing dressing or when you are performing wound care? And this is your wound care assessment flow sheet. As you can see here, this could be a daily basis. You have to put the date here, like for example, February 2, 2022, February 3, February 4, and so on. From the time that you did your wound assessment, the location, what are the vital signs of the patient, stage, size, length, width, and depth. You can ask help this from the wound care nurse. And the wound care assessment flow sheet continuation, we also have the tissue type. We have the legends at the first page. If there is any signs of infection, just put check. Is there a wound present? You can put check or yes or no. If there is a swab taken, you have to put check. If you prescribe medication due to pain, you can also put check here. And it must be reflected on your patient's family education record. For the supported therapy, is there any compression, offloading, pressure redistribution device, and others? Or like Yani, you refer it to other multidisciplinary team. For the stage 1, for the first and second stage, burn from first degree, all surgical wounds and all skin tears. So for the Hamad Home Care Services wound care, those patient who has pressure injury, third degree and above, all DM ulcers, burn second and third degree, non-healing leg and foot ulcers, skin tear category 3. You may refer them also to dietitian, dermatology, and podiatry. And don't forget to write your name in completed by, signature, and title. For the optimum healing environment, it has been demonstrated that wound healing is impaired when the wound temperature decreases or increases even 1 degree Celsius. So as a nurse, you have to avoid exposing the wound to cooling or heating devices. So do not use the newly ironed clothes or bed linens to your patient. Avoid leaving wound exposed for a lengthy period. Use wound cleansing solutions at body temperatures. Ensure adequate hydration, avoid or limit contact with plastic bed protection covers and plastic lined garments, and you have to provide advice on interventions appropriate for maintaining core body and skin temperature. You have to provide health teachings to both patient and family members because sometimes they keep on refusing and they are not compliant to treatment. Prevention and manage infection. How to prevent? So as a nurse, you have to strictly follow the infection control practices. This is to reduce the potential risk of wound infection by performing hand hygiene and using sterile and or non-sterile gloves. This is to avoid the risk of contamination for both of you, the patient and the nurse. And you have to assess for the clinical signs and symptoms of wound infection. That's why you have to report that immediately to the assigned Hamad home care nurse, to your supervisor and head nurse, or any admin team. So what are the common materials used for wound care? We have the normal saline. This is the preferred cleanser for most wounds because it's always physiologic, always available, and safe. Next is the UC solution or Uxol. This one is a sterile, ready-to-use debridement cloth for cleansing and moisturizing the wound edge, and even the skin surrounding. So there is an active ingredient such as poloxamer and allantoin that are self-friendly and non-allergic, dissolve and remove biofilm as well as necrotic tissues and promote cell regeneration. So the characteristics of this, it's like when you use this is like a liquid soap. Silver cell non-adherent. This one is a sterile absorbent antimicrobial wound dressing for use in moderately to heavily exuding wounds and in wounds that are infected or increased risk of infection. As you can see, it's just like a charcoal film. We also have the ProHeal AG. This one is a 100% dermal collagen wound dressing, and it's act as a biological therapy in the wound healing process until final wound closure. We also have the Mepilix border. This one is a soft silicone foam dressing that minimizes trauma to the wound and pain to the patient during dressing changes. As you can see here, this is like a square big type of band-aid. We also have the Aquacel. As you can see, it's like a strip, but we also have a size of 10 by 10 sterile gauze. And this one is a primary dressing on a shallow wound, used as a secondary dressing on highly exuding wounds, and used for skin protection as a part of comprehensive protocol of care. If you have available 10 by 10 size, then you can cut it depending on the size of the wound. And this one is a good type for, it looks like when you applied it directly to the skin, it looks like it is absorbing all the discharges from the wound. So we also have the Hemagel. Hemagel is intended for the healing of acute wounds such as superficial wounds, including first and second degree burns and post-operative wounds, and it is also suitable for the healing of chronic wounds such as shin splinter, bed sores, and skin defects of patients with diabetes. This Hemagel, you can apply it directly to the skin, or you can apply it directly to this Aquacel, then put it on your patient's wound. New gel. This one also helps to create a moist wound healing environment and is indicated for the treatment and the sloughing of wounds together with the management of chronic wounds throughout the stages of the healing process. This also this new gel is also good for faster healing wound. Granudescent solution. So this is an irrigation solution for cleansing and moisturizing acute, chronic, and contaminated wounds as well as for first and second degree burns. So this is just like a spray. So all you have to do after cleaning the wound, you have to spray it directly. Then you have to leave it for at least 2 to 3 minutes, then apply all the dressing. Betadine solution, but this one is we're not using this anymore to the large size of wound, but this one but this betadine is used on the skin to treat or prevent skin infection in minor cuts, scrapes, or burn. So this betadine is also used in medical settings to prevent infection and promote healing in skin wounds, pressure sores, or surgical incisions. Home care services wound care team. First, if there is any analgesia required, what are the objectives of the treatment? how many times you will do the wound care, what are the cleansing solutions to be used, and how will you do it, the cream or oil used in surrounding skin, what are the size and quantity of primary dressing used, is there any tape or fixation required during wound care. So for the basic dressing technique, first is you have to check the patient's clinical record for any medical or nursing orders. Attend hand hygiene before touching the patient by either hand washing or using alcohol-based hand rub. And you also have to ensure the privacy of your patient. Then don't forget to explain the process and purpose of the dressing change, and you can obtain a verbal consent. Confirm if there is any allergies to dressing or tapes, and even for the gel to be used. Ensure adequate analgesic cover prior to dressing change if required. Then ensure the patient is placed in a comfortable position. You had to set up the equipment by the side of your patient. Discard packaging in general waste receptacle. Don PPE prior to opening sterile equipment and expose the wound site. Then, once you are ready, you have to remove the soil dressing and discard it immediately. The dressing and gloves into the clinical waste receptacle. Then, another hand hygiene by either hand washing or using alcohol-based hand rub. Then, you have to apply another gloves because you throw already the used one. Then, you have to measure the size of the wound. You can use the ruler on wound assessment form, but make sure the paper does not touch the wound for infection control purpose. And some, if you have available the sterile wound care pack, there is available ruler there. You can use that for wound measurement. And you have to ensure that the process is timely so to avoid exposing the wound to cooling temperatures. Then dispose again the gloves that you used. Then you can don another set of gloves. It could be clean or sterile. Then you have to start the wound care by cleansing solutions at body temperature. Irrigate with normal saline solution to remove debris and contaminants. Then clean the wound surface, swabbing from non-discharge area to discharging area, from clean to dirty in one direction, and discard the swab used. Do not reuse the swab or the gauze that you used with discharges. Or you have to use gentle irrigation method by allowing a controlled pressure of saline using a syringe or saline container by using warm normal saline. And do not use cotton wool swabs, and use gauze swab only for cleaning the wound. And you have to perform a comprehensive wound assessment as identified. Then, while you are doing the wound care, as a nurse, you are also doing the assessment for the wound. You have to identify if there is any presence of infection. If signs of infection cover the wound, then you have to notify the Hamad Home Care nurse for review and apply new dressing and secure with adhesive tape of bandages. Sometimes the patient prefer the elastic bandage, and some of them are using tubular net. So clean trolley or surface with detergent impregnated wipes. Attend hand hygiene by either hand washing again or alcohol-based hand rub. And ensure patient is comfortable with new dressing change and understand when the next dressing change will be attended. For the wound photography, so this one is very useful. Visual record for wounds that are difficult to trace, measure, and may be large, deep, or irregular in shape. Patient's consent must be gained prior to wound photography and documented on the Tabeeb Care Informed Consent for Home Healthcare Services form. Some patients, they wish to take photographs of their own wounds on their digital device as a means of personal record keeping, and the staff can assist with this where necessary. And wound photographs may also be documented by the assigned nurse in the nurse body application. You can take a photo of the affected area only, not including the face of your patient or any part of the body, only the affected area, only the wound itself. Okay. For the documentation, To ensure all wounds is documented regularly and clearly to aid continuity of care, wound assessment tool must be completed. In the clinical record and wound care chart, you have to include your assessment. What are the findings during your assessment? What are the type of dressing applied? Any changes of the dressing, the reason for change, is there any signs and symptoms, or is there any signs of wound infection and action taken? So documentation must be recorded in your TCMS wound care assessment and treatment flow sheet. This is for private patient. And to those under PNS clients, so you can use the HMC PNS wound care assessment reassessment flow sheet for PNS clients. So that would be all about the wound care management. So thank you for watching. Have a good day. Bye.